We've done a number of episodes on the potential benefits of drugs that are illegal or otherwise strictly regulated. Quality studies are often difficult to find, and a major reason for that is that it's difficult to obtain the drugs for study. It's a major roadblock, and one that is being addressed in a new marijuana research bill, and that's the topic of this week's Healthcare Triage. Drugs classified as Schedule I controlled substances, like heroin and LSD, are difficult to study because there are lots of stipulations on their use. If a scientist wants to study a Schedule I drug, they must apply for permits from the Drug Enforcement Administration. There are costs to these applications, both in terms of time and money, with the bigger obstacle being time. According to some sources, the DEA has been taking a year or more to respond to these applications. The new bill, called the Medical Marijuana and Cannabidiol Research Expansion Act, addresses this by requiring the DEA to respond to permit applications within 60 days, either approving, denying, or requesting more information. If they're requesting more information, they must respond in 30 days to researchers who submit what they were asked for. Another issue is access to the drug for research, particularly in large amounts, which the bill also addresses. Congress will now keep tabs on whether the supply of marijuana is sufficient to meet researchers' needs, and if it isn't, what's being done to address that. Fortunately, starting last year, more facilities have been given licenses to provide marijuana to U.S. scientists, and that's good because before that, there was exactly one facility in the entire country licensed to provide marijuana for research. Researchers are still pushing for marijuana to not be classified as a Schedule I substance anymore, and in October, President Biden asked for a review of the drug's classification, pointing out that marijuana is currently classified higher than drugs like fentanyl and methamphetamine. Moving marijuana to the Schedule II category would still classify it as having high abuse potential, but its potential medical uses would be recognized, unlike drugs in the Schedule I category. As a 2016 Vox article points out, the perception of marijuana's dangers, and thus the way it is scheduled, was and may still be based more on people's belief that it harms the moral fabric of the nation rather than on any proven negative effects. To be moved to a Schedule II, though, there needs to be sufficient evidence that a drug has medicinal value. To prove that, research needs to be done, which is difficult with a Schedule I drug. That puts marijuana between a rock and a hard place, so measures to move forward are certainly welcome. An initial draft of the bill included a provision for scientists to purchase the same marijuana available in states where it has been legalized, but that provision didn't make it into the final bill. Scientists are pretty bummed about that because it makes it difficult to study real-world ramifications, but they'll take what they can get for now. At this point, you may be wondering how marijuana has been legalized in so many states if it's still classified as Schedule I and federally illegal. This is an issue of states' rights versus federal authority, with states legalizing marijuana doing so in direct opposition to the federal government. In 2013, the Cole Memorandum was issued, which stated that the Justice Department would not challenge state marijuana legalization laws so long as states took it upon themselves to keep things appropriately regulated. However, the Justice Department took that back in 2018, issuing a memo directing enforcement of federal laws related to marijuana. However, even after this, cases in which state laws were being complied with have generally been left alone by the Justice Department, so it looks like they're still going with a hands-off approach. Also, the president recently pardoned all prior federal offenses for simple marijuana possession. But I digress. What matters here is that this is an opportunity to better understand marijuana and health, and we're always excited about anything that boosts health research. Hey, did you like this episode? You might enjoy this previous episode on Can Marijuana Help with Opioid Addiction? We'd appreciate it. If you'd like this video, subscribe to the channel down below. Consider going on over to patreon.com/healthcaretriage, where you can help support the show, make it bigger and better. We'd like to especially thank our research associates, Joe Sevitz, Edward Lillaholm, and Brian Nam, and of course, our Surgeon Admiral, Sam.